Sounds good.
Hello, everyone. I'm Dr. Diana Bitner, founder of True Women's Health and physician at True Women's Health. And with me tonight is Chef Anna, our True Nutrition Coach. We'll get to meet her in a second, but what I'd love to do first is go through some bookkeeping. You'll see posted very soon our schedule for the next several months, well, at least this next month, about our Facebook Lives coming up. We've got a great lineup for all of you. So please like and share and spread the word. We've had so much good feedback about all the great guests we've had on and the tidbits that people can take into their lives. I'm just so honored to be involved in your health and your wellness journey. And so welcome. We also, in terms of what we're going to talk about tonight, so the agenda involves, first of all, why I care about nutrition and why we at True hired Chef Anna. We're going to talk about why Anna cares about nutrition and food and a little bit about her background. And she's already seen lots of our patients and everyone's very happy. So I'm very excited to introduce Anna to you. Also, we're going to talk about at True how we provide nutrition services and what that looks like. And then we're going to get a little bit deeper into the details. We get asked about food so much and nutrition so much at True. We're going to get into some of the details about food, what matters in terms of portion size, what kinds of food matters, what are the tricks of midlife and menopause, and how this all applies to our mission at True, that we're helping you live your truth. And so let's get started. I care about nutrition, first of all, because I've loved to cook since I was a teenager. It was a way to explore good tastes. And Anna, so if you would tell us about you, why do you like food and nutrition? How did you get into this?
Absolutely. So I had a similar, I love meeting with people, having that connection, and food was that connection for me. I started off catering. So I was going to different parties, being able to give that instant gratification, bringing people together, interacting with others. And so that's how my journey started. And then it just continued to grow. Food was always a big part of, we always did family dinners every single night. So
You've
food
got
was
lots
always
of Italian in you, if I don't.
Absolutely,
right?
yes, definitely have that Italian in me. And so family was really important. And food, once again, brought our family together. And it was something fun I could do with my mom. We could plan it. And then I got to cook it. And it was instant gratification for my family. And then now, many years down the line, my guests, my patients.
I love that.
It's been a really great journey.
And, when the first part of my life as a very young child, I grew up on the typical mashed potatoes, corn, green beans out of the can. And then, as I met the family that took me in when I was 15, we ate broccoli. What was this? We ate salmon. What is that? And really learned to enjoy good food. And it was something fun I could do with my mom, Kathy, and really learn to cook with her. So I think the same kind of thing, that it became a part of my life. And now I see more and more how it impacts health.
Absolutely. And I also loved growing up too and cooking with my mom and going and picking and my grandfather was a farmer actually. So going and picking those vegetables, my dad was a deep sea fisherman. So he would always, far before I was born, but he would always go on.
That's one thing I didn't know about your dad.
And so he would come back and we'd have fresh fish, and just really being able to flavor that with simple spices and the true goodness of the food, just being able to shine through. So, and being able to grow basil and grow all of our herbs and things to really season the food. And it's just so gratifying and such a cool experience.
I love that. And I do want to say to our listeners, please feel free to put in your questions. We want to keep this real casual. Again, this is a let's chat about nutrition. So let's chat. Feel free to leave your questions. And if you're watching this after the fact, feel free to put your questions in our Facebook and we'll make sure and we answer that. So, Anna, how did you start on your journey to being Chef Anna? What happened in terms of schooling? Can you give us a little sense of your background?
Absolutely. So nutrition was a really important. I started off catering, like I stated earlier, and that really opened the door for me. I learned about all different types of food. I learned about all different ways that food could be created, and so that led me to. I graduated from Loyola University in Chicago with a degree in food nutrition. And then from there, I ventured on to culinary school at the Culinary Institute of America. And from there, I was able to just really immerse myself in the food world. And then after that,
well, didn't you work in the restaurant industry for a bit and maybe just wasn't a good fit for the lifestyle, working nights and weekends, right?
yes.
But I would imagine you worked with some really amazing chefs and learned lots of great tricks.
Yes, I truly did. And one of the last restaurants I was at was Spiaggia in Chicago, right off Michigan Avenue. So I've got that Italian theme continued through my life and got to learn even more in depth. So that was a lot of fun. And then from there, I decided to take a career change, and I worked for a contract food service company, and I manage hospital food service. However, the journey of food continued to follow me. There was something about the food, seeing my patients, bringing their food to them. Not every patient did I get to do that, but I really, when was rounding on my patients, and it was the thing they look forward to the most. So it was really imperative that we use the best ingredients around. We were able to substitute, there's so many restrictions in the hospital diet, but we were able to create food that tasted wonderful and met those nutritional restrictions that they were on.
And I love that because as you talk to our patients, you're able to substitute, for example, what they might want in terms of cultural. They want a more typical Indian diet. They want a typical more Mexican diet. They want a more typical Spanish diet. So I love how you're able to substitute different herbs and spices. Or if someone does have high blood pressure or diabetes, how can we make substitutions that don't make people, they don't leave people hungry, they don't make people feel like they're missing out?
Missing out, exactly. And I look at food as nutrition to the soul as well. So that really came into play when I was rounding on my patients again at the hospital. And what were they looking for? How could I help them? This was the only thing that they looked forward to throughout the day. Who likes being stabbed with needles and woken up and blood pressure taken and all those other things that occur when you're at the hospital. Exactly. So making that connection.
Well, and the other thing I think too, so many women are stressed out by food. It's like, oh, I got to make dinner. Oh, I've got to pack lunches. Oh, I have to. And so it's, how can we switch food from a stress to a good part of life again? How can we help take that stress out? So, of course, I can't wait until our cookbook comes out, Doc in the Kitchen with Chef Anna, right? And we'll have tips and tricks. But in the meantime, we really want to offer that on a practical basis to our patients. And I understand you have a story you'd like to share that kind of demonstrates this. I love the story.
Yes. So this takes me back to Maria. She was a patient of ours the diabetes clinic that I oversaw.
In the Chicago area, right?
In the Chicagoland area, yes. And so Maria came to us. She had type 2 diabetes. She was overweight. She was overwhelmed with family life. Didn't even know where to begin. And so we started this journey with Maria, really trying to focus on those key things that were her barriers. What was making it hard for her? Why?
Eat healthy, right?
Yes, eat healthy. And part of the barrier was just getting to the appointment. So she kept missing appointments, but you saw the need, you saw the want in her when she did show up. So we were able to, my team came up with a plan, and they were able to um, work with her. Her daughter was bringing her. So her daughter had to go to work, got called into work. So that was a major barrier why she wasn't showing up. So by the end of her journey with us, we were able to plan out a bus schedule for her, so she could come to her appointments. Therefore, she was walking to the bus stop and then walking to the hospital, getting exercise. She began to see small wins.
Sure.
And then also really talking about food choices, starting small and
what
making.
were those little tricks that you talked to her about? Because what did she come in, like, what did the family want to eat? Was it
Family
more?
wanted to eat white rice. They wanted to eat tortillas, corn tortillas. So the small things that we did was flavoring the brown rice. So it wasn't exactly for her, but they began to really, she would make it a point to try.
So what kind of spices? Maybe a little cumin, what kind of spices would you talk to her about?
Yes, absolutely. Cumin, coriander, salt and pepper, and then also making that tortilla choice, making that a whole grain tortilla versus the corn or white tortilla.
And again, with diabetes, right, it's about those simple carbs. We've got to get those simple carbs out of the diet and add in the complex carbs.
Yep, absolutely. So by the end of her journey, she was off of her medication, had lost significant amount of weight, and she had pride. She saw the results. She was feeling better. She had more energy.
I love it.
It was just an amazing story. So like I stated, we started out really struggling at the beginning.
And in the end,
tenacity and those giving the tools for her toolbox so she could succeed.
I love it. Well, we have a great question from Chris Baker. And what I would love to do, Anna, if it's okay, is start with my answer. Correct me if I'm wrong, and let's kind of talk about this. This is such a common question. Chris is asking, my husband is on a low carb diet by choice and would like me on the same diet. Are low carb meals good to eat every day? What I want to think about how I think about this is that, especially in midlife and menopause, especially if you have a high risk of diabetes, it's so important to maintain complex carbs in the diet. And those are carbs with color. So sweet potato, brown rice, whole wheat tortillas. It doesn't mean a lot of food. It doesn't mean a lot of calories, but we've got to keep that blood sugar stable. Like the low carb thing does not work well for women in menopause. Anna, what do you think about that?
No, so it brings us right into the seeds and linking us to the recommended diet, which is 5 smart carbs, 5 smart proteins, 3
smart fats.
Sorry, I just blanked. And 1 treat.
1 treat.
Yes.
That's 1 simple sugar, right? So
yes,
exactly. And so tell me about the low carb. Like if somebody were to ask you that, what would you tell them? Like, am I supposed to eat like low carb like my husband?
Right. So I think it's really important that we are able to,
well, it's having that complex carb like at breakfast, because I think if we just eat 0 carbs at breakfast, like a patient I saw today, or we eat high carbs like a donut, then our insulin is up for the rest of the day, and now we're craving sugar. Right? So like, what would you suggest is a perfect breakfast? Because like Chris is just saying, she gets hangry. So do I. So what's a good complex carb for breakfast?
So a great complex carb would be a whole grain choice, a half of a bagel, a piece of toast.
Ezekiel
toast. Yes, Ezekiel toast. And then a tablespoon of peanut butter on it. Another trick. Or an egg, exactly. Another trick that I like to do is, if you need something fast and on the go, you fill up your bowl full of fruit. So you put the fruit on the bottom, so that's the main serving of the bowl, and then you put your whole wheat thin or cereal on top, whatever that may be.
Like an oatmeal?
Or an oatmeal, exactly. So, and it's filling that bowl with the fruit at the bottom. So you're getting, and so you're not filling it with oatmeal on top.
And then
On the
putting a
bottom.
little fruit on the bottom.
Right,
Oh,
exactly.
I get that. And the other thing is, I think it's so important to have a good complex carb at lunchtime. So, for example, having a half a cup of brown rice, having that whole wheat bread, having a whole wheat tortilla with your salad and chicken. So many patients I see, they're not having any carbs all day, but then, like Chris says, they get hangry. So they get home and they're starving, or it's dinner time, and they just inhale everything. And then just once you start that sugar, then it just goes from there.
Goes. And I think a really important point too is that when do you eat your carbs? At what time? So those smart carbs, it's important for breakfast and lunch. After 4 o'clock, you don't want to be eating those carbs. So really, it's timing. It's ensuring the proper portion and getting those 5, however you'd like a day, in. So it's timing and portioning.
Right. And I would say the biggest trick in midlife and menopause, and again, especially if you have a history of diabetes or you have diabetes in pregnancy, it's no carbs after 4, and it's complex carbs every meal up to that point. It just makes such a difference, because then you're not hungry, you're able to think straight, do what you got to do, and then dinner, a protein and a veg. And Anna, one thing you've taught me is, I've learned to cook my carbs and proteins separate at dinner. So, for example, I'll grill chicken, I'll make brown rice or sweet potato fries, and then a salad and a veg. And I'll still eat the meal with my family, but I won't have the carb, but I'll save some for myself for lunch tomorrow.
Absolutely. That's a perfect example. Also, I think what's really important too is when you're thinking about, it comes down to planning as well. So when you're thinking about going, you have to have these items in your house to be able to serve them. So thinking about your shopping list and planning your meals out, making a shopping list. It's really important. It saves, in the long run, it saves time, it saves you energy. And again, you have a plan. You feel confident. You know what you're going to be eating and consuming.
I love that. I love the statement. If you fail to plan, you're planning to fail.
I love that too.
So I love that. And Carol's asking you a question: are protein shakes good for diabetics? Again, Anne, I want to hear what you're going to say, but it's something that I would say, I want you to have a complex carb as a diabetic. My favorite book about this is called Sugar Busters. And Sugar Busters really teaches the glycemic index, or glycemic index. So, for example, if you have a protein shake with a little bit of sugar in it and no complex carbs, then your blood sugar is going to go up and crash, and then it's hard to control it, especially if you're on insulin. So it's so important to have that little bit of complex carbs. So if you're going to have a protein shake, make sure it's got some complex carb in it, or add some frozen yellow bananas. Yellow bananas are low sugar. Add some frozen bananas. Add some powdered oatmeal. I'll take oatmeal and just grind it up in the blender, store it in a little bag, and then I can pour a little bit of ground up oatmeal into my shake, so I've got some complex carb. Anna, what do you think about that?
I think that sounds wonderful. It's really adding to your, as you stated, that complex carb to stabilize those sugars so you don't spike. So that's the key.
Exactly. So when you see, so at True, again, we think it's so important because, again, number one, most patients come in not saying, oh my God, I have hot flashes. Most patients come in and say, I don't feel like myself, or it doesn't make sense. I'm gaining weight and I just can't figure out why. And we really feel strongly about offering a solution that is about healthy whole food, is about people knowing their options. And, it really makes a difference. And you and I have talked about this. When I first started practicing medicine, people would say, I gained 30 pounds and I don't know how. And I used to just internally roll my eyes like, come on, how can you not know that how you gain 30 pounds? But I really learned it's way more than calories in and calories out. It is about the first 10 pounds, everybody knows. You went on vacation, you sprained your ankle, you got really busy, you couldn't work out. So that first 10 pounds, we all know why we gained it. But when people are insulin resistant or pre-diabetic or menopausal, their insulin takes over and boom, those next 20 pounds just come on. I love helping people walk through that. So Anna, if I were to send you a patient, with that issue and you do a video visit with her, what does that look like?
Yes, so the first visit is a very informative visit. It's kind of a basic overview. So we review the 5531, and we also go through those tips of what is a serving size? What does that mean versus a portion?
Tell me about that. What is
Yeah.
a serving size?
So serving size is what is quantified for the recommended amounts, whereas the portion size is the amount of food that you choose. So it may not be it's just whatever you choose. You may be eating less of a portion size, or you may be eating more of the portion size, or serving size, I'm sorry.
So what's a good portion size of a complex carb?
Yes, so we want to be getting, you want a cup of ready-to-eat cereal, a half a cup of cooked rice, half a cup of cooked pasta. We want that to be whole grain pasta.
Wait, back up on that. So it's only a half a cup of cooked pasta.
Correct.
So that's not very much at first. It might not seem like very much.
Right, exactly. So it's really getting in tune with what a serving size is. Reading the labels, starting to read the labels of what does constitute as a serving size, and just getting that conversation started. So you can have the tools in your toolkit to succeed, and you know what you're up against in so many words or less.
I love that. And you also do what we do, everyone at True does, is we really want to know what people want. What is their goal? Right? So we connect everything to their picture of self. And I've been so honored that people have shared like what they really care about. So at their 50th birthday or at their daughter's graduation from high school. And I had a patient the other day whose one daughter's graduating from middle school next year, one daughter's graduating from high school, and her son's graduating from college. So she had them all 4 years apart. So she's really thinking about at that event next year, she wants to feel energetic and capable and proud. And so again, food is a big part of that, right? So we want to know what their goals are.
Absolutely. And, in the first question I ask is, what do you want to get out of today? What are you looking for? And then I also follow up the meeting with a couple handouts from the American Dietetic Association that I find very helpful, talking about serving size versus portion size, and talking about different recipes, just some suggestions. And then the USDA has put out a nice little cheat sheet, in so many words or less, of a 7-day diet and meal plan. It's a meal plan on a 2,000 calorie diet. So just getting us starting.
We're used to using the word diet. Why not, right? So diet, food plan, whatever it is, it's having a plan. But I like to think about it too like a budget. Like you have a money budget, and if you don't follow the budget, you might run out of money by the end of the week. If you don't follow a food budget, right, then all of a sudden you've eaten way too many calories and you might not meet your goal.
That's a great analogy. Absolutely. Absolutely.
So that's fun. So have you, in terms of like, what else are people looking for that you've talked to? Is it meal planning? Is it,
Yes, it's meal plans, it's snacks, what's quick on the go, that how do I make that available to me? I like to think, again, going back to that shopping list and gathering that and really sitting down, and we want our plate to look colorful. We want our snacks to be colorful. Therefore we're getting those nutrients, those vitamins, in our diet that we need. So going back to, again, it's planning and just trying to incorporate some tips and tricks to get that kick started.
Again, and that's why I love the 5531. And in terms of the seeds, we also talk about micronutrients. So I have a lot of patients say, should I take a vitamin? And I always say, it's not going to hurt you. It might help you. Why not?
Absolutely.
And the first vitamin that doesn't give me a stomach ache is the Isogenics vitamins, but Nature Made makes a great one. Most stores have a general brand of a vitamin. Amway has great vitamins. So it's just important to find a vitamin that you like, that you'll take. And then vitamin D. Now, calcium is something that I really want people to get from their food. So what foods are going to be higher in calcium for people to think about?
When you're making your selections at the store for dairy, we want to choose low fat and or fat-free options. Those will really help in the long run.
Exactly.
And so a cup of milk is a serving size.
So it's good for the calcium, but no vitamin D. We're not going to get enough vitamin D in the milk at all.
Right. Sorry, I was thinking calcium. Yes.
No, me too. I'm sorry. I interrupted you. I'm sorry.
No. So collard greens, spinach, broccoli, kale. These are all things that are going to get you your vitamin D.
And the calcium.
And the calcium as well. Yes.
Yeah. And I love, there's actually an app that you can get on your phone called the Calcium Calculator. And what I'll do is kind of load it on my phone for a couple days, watch my food choices, see if it adds up to 1,200 milligrams of calcium. And if I'm there in terms of my calcium, then I don't need to take a Tums or what other calcium supplement. But my favorite thing for calcium is to have a kale romaine salad with Caesar dressing with lots of anchovies, because those anchovies have all those little bones, right? So there's lots of calcium. And then Parmesan cheese, as I understand it, has more calcium than any other cheese because it's so dense.
Yes.
Right? So a Caesar salad with anchovies, you're set for the day probably, I would imagine.
Yes. Yes.
So fun. So what do you think, Anna? What's that?
That's making my mouth water. It sounds delicious.
So fun. Well, and what I love is, have you, as we start to get people on our app, so at True Women's Health for our patients, we have the True app. And on the True app, women track their habits and they track their seeds. So again, the 7 essential elements, they're tracking what they're eating and their vitamins and all of that. So it'll be fun to see, like, you do your visits on our app, right?
Correct. Yes. So they are virtual video visits. So it's been working out really great so far, and it's very efficient.
And you can see people's seeds before then. So what I love is that maybe before they might not be having any complex carbs, maybe they're having more treats. And then after the visit, you can see how their seeds change and then how their symptoms improve.
Yes. And I think that's the most rewarding part, right? So it's seeing that change and pointing that out, and even the small wins. It's really important. And when we're talking about this as well, we have to start somewhere. So just taking small steps, it may be very overwhelming, but at the end of the day, if we can focus on 1 or 2 of the seeds and make that commitment, and then and then we're able to track that in the app, and I'm able to see that. That's what's most rewarding.
Cool. So tell me about water. How does water feed into our diet? We talk about 80 ounces a day for the seeds. So how do you see that fitting into the diet?
Oh, so that is utmost important. Gives us our energy, keeps our bowel movements going, just keeps everything regulated.
And it also helps not have hot flashes.
Yes, and hot flashes, exactly. So it's really, again, that's something else, that take it a small step. Start with a couple glasses in the morning, couple glasses in the afternoon, and then when you're having a snack or get hungry, and also before you eat, drinking a glass of water help you feel full, so you don't consume as much as well. So it's really important in getting those 80 ounces a day.
Exactly. And I also see that, for example, when we're thirsty, we tend to want to have ice cream, something that's wet and cold. We want to have maybe more fruit than even we should have in our diet, because of the sugar. So it's really common that when people are thirsty, they perceive that as, hunger for something, again, cold and wet. And
Cold.
so
Yep.
so I would recommend, just like you said, is drink that glass of water before that treat, and maybe then you can just have a bite of ice cream, not a whole bowl of ice cream. So like you say, I love how you say it's those little wins that
Yep.
we can do. So what I'd like to think about is, what are 5 tips we can leave with? I'm going to say a couple, and then maybe think of a couple that you would leave people with. I'll say tip number 1: no carbs after 4 on most days. We're not looking for perfection, but if most days dinner can just be a protein and a salad and a vegetable, and that's the win. It is, if you are starving for a snack later in the evening, 7, 8, maybe it's a popcorn without butter. So it's like a Smart Pop or some brand of popcorn, or make your own. It just has a little bit of oil, some salt, of course, unless you have bad hypertension, but some salt, and or maybe a cheese stick or a couple almonds, but just to have a little bit of something, but mainly no carbs after 4 on most days. I would say, what's a tip you might have? We'll get to 5.
So making your plate colorful. So I talked about that a little bit earlier. Making your plate colorful. That's where you're going to get your nutrients and your vitamins from, those colorful vegetables that you have on your plate. So if it's all white or all one color, it's not very nutritious at all. So the more colorful, the more nutritious.
I love it. Okay, so tip number 3, make sure you start out your day with some good complex carbs. So complex carbs can be anything from, I love on the weekend, some brown rice with a little olive oil, a fried egg, and some maple syrup. Ooh. Real maple syrup is a low complex carb, a low glycemic index carb. Okay. So it's good to sweeten that. So again, brown rice with a fried egg and maple syrup. Again, Anna and I could talk about food all day. So, and then maybe a snack in the middle of the morning with some Triscuits and a cheese stick. Keep those carbs. And then lunch, gotta have a complex carb, like a piece of Ezekiel bread, some avocado, and some boar's head turkey. That's my favorite. And so it's making sure we start out the day with complex carbs. Okay, Anna, tip number 4.
Okay, create that master list before you start shopping. It starts with a plan. So creating that master shopping list, and then that way you don't get lost in the store. You have a plan, you know exactly where to go, what to buy, and you're able to have those healthy choices in your refrigerator, in your pantry, ready to go when you're ready for them.
I love that. And I'll leave you with tip number 5. Yes, you can have a treat, but the treat should be small and real. Enjoy your treat. It's maybe a square or 2 of dark chocolate. If you are with friends and you want to have a glass of red wine, have a glass of red wine. But it's the red wine, it's just that you've got to budget it. So if you're going to have dinner with friends, you can have a piece of salmon, some vegetable, and then your glass of red wine. No bread, no rice, and no dessert. That red wine is your treat. If you're going to have a mixed drink with some vodka, and Anna and I are going to talk about alcohol the next couple of weeks, but it's about having maybe a half a shot and more club soda. So it's having a treat, but it's limiting it. Anna, what would you add to that? You've catered, you've made more beautiful desserts than anyone I know. What would you say about treats?
No, I think it's just choosing wisely, and knowing I guess the freshest fruit or freshest fruit for dessert,
and a little mascarpone cheese, or a little bit of fresh whipped cream on top, or just making it beautiful, savoring it, eating it slow, because if you eat too much, then it's just going to feed the fire and you're going to be back to those cravings again.
Absolutely. And that's a great point too. The fresh whipped cream, that's always a go-to. Put a tablespoon on top of your berries.
It's just the best.
You can even reduce balsamic vinegar a little bit and put a little balsamic vinegar on top.
So I can't wait, Anna, until, at the True clinic, at the True office, we have a lovely kitchen with a big TV and a camera. So we plan on cooking together at the True kitchen and really being able to demonstrate for people, some of these recipes that we're talking about. We plan on having a food blog on the website. So I really look forward to sharing these healthy, fresh recipes that people can use and still enjoy food with their family and not gain weight as they age. Again, at True, what we want people to know that it is possible to reach your goals. It is possible to age without gaining weight like your mom did, or your aunt did, or your grandma did. It's very possible, even if you have a history of diabetes, even if you have a history of everyone in your family is overweight. It's possible to not be that if you don't want it. Now, we don't all have to be skinny to be happy and healthy, but boy, I want your blood sugar healthy. I want your cholesterol healthy. So you don't have to have a heart attack like 1 in 3 women in the United States do. So we're all about supporting you in terms of what are your goals with these helpful tips and tricks. So what I look forward to is everyone getting to meet Anna. So if you're a patient at True and you want to have a visit with Anna, we certainly can get that set up. We have 2 different programs at True. We have Wellness and Ultimate Wellness. In the Ultimate Wellness or Concierge program, all your visits with Anna are included. With the Well, we charge a basic price to have that visit with Anna, and we really want to incorporate these visits so we can help you meet your goals. So Anna, any last thoughts you want to leave the group with tonight? And again, we'll answer questions in the future as they come in.
I just look forward to working with you and going along this journey with you. It's a lot of fun, and we can take the stress out of it.
I love it. Thank you so much. So thank you everyone for joining this episode of Let's Chat About Nutrition. We'll see you soon for our next episode and look forward to connecting with you soon. Have a good night.